All right, welcome back, everyone, for another episode of the Chamber Podcast. My name is Rob Johnson. Joining me in studio today are a couple of folks from the Dermatology Specialists of Brighton. With us in the studio is Jason Huey and Dr. Caitlin Porubsky.
Hi, Rob.
Welcome all.
Hello.
Thanks for having us.
I'm doing really well. Good. We've had a really good pre-show.
Yeah.
Sitting here chatting about all things dermatology and everything else. So glad you guys are on the show. So largely, I know you guys both said you've listened, so you kind of understand the format, what we want to focus on. But largely what I want to do is just kind of talk about you guys, how you got into the dermatology field, and then talk about some things that people should be aware of. As Jason and I were talking in the green room about how COVID has kind of thrown everyone's cycle off for regular checkups, and hasn't really been a lot of consistency or habits surrounding regular checkups. So we'll dive into that as well. But before we do that, let's dive into you guys and talk about who you are and what you do and why you do it. So Jason, we'll start with you, sir.
So my name is Jason Huey. I'm a physician assistant. I've been in dermatology practice for 20 years now. I first started out in the Flint area, and then recently, this past year, I moved to the Dermatology Specialists of Brighton.
Very good. Very good. So Caitlin, we'll pop over to you.
So I am Caitlin Perovski. I'm actually originally from Plymouth, Michigan, and kind of started off in the medical field. Always wanted to be a physician, and throughout high school and stuff started shadowing physicians, and one of them was a dermatologist, and I thought it was such a neat, which we'll go into later, all the cool aspects that we do in dermatology, but and then through medical school just kept focusing on that and got some mentors and did some research and just really fell in love with the specialty. And then after residency, moved back to Michigan, and Brighton's been kind of my home base now with the Dermatology Specialists of Brighton. Actually, I have a lot of connections to Brighton. One of my best friends is from here. My brother lives in Howell. My sister-in-law used to be a teacher at St. Pat's in Brighton. So it's been kind of nice getting to know the community here.
That's very cool. I've always wondered when people are in that undergraduate level for school, and whether you're, getting ready to do the graduate level PA classes, or you're getting ready to, go into med school and prepare for what a residency looks like. What is the decision-making process to pick that specialty? Because I've always wondered because there's certain specialties, and I'm like, I don't know. It's a special person that wants to, dive into that deep of a topic. And dermatology is obviously something that's extremely important, and something that I would say is probably one of the more neglected things that people fail to do regularly. I don't have stats on that, but it's just kind of how I feel. Great.
But it's true. So.
Yeah. Oh, good.
Yeah. For me, I initially wanted to go into sports medicine. And then as I went through the training, it just didn't pan out that way. It just didn't work. And then initially, actually, I did not want to do dermatology, and I did not want to deliver babies. Those are the two things I knew I didn't want to do. And then I met.
Now you're a pediatric dermatologist.
Yeah, there you go. There you go. How weird how it comes around.
Yeah.
So then I ended up meeting my mentor, and my mentor just basically took me under his wing, and he trained me, and I fell in love with dermatology. I've always been a visual guy, and as Dr. Porubsky was saying, our specialty has a lot entailed into it, and there's a surgical aspect, and I've always been good with my hands, and so it just actually came pretty natural for me, and I've stuck with it.
That's very cool.
Yeah, I was just going to add, definitely dermatology is, in med school, we didn't have a specific dermatology rotation. You kind of had to seek it out, and so I think it is something that is a little bit more neglected, but similar. I had a really great mentor who's a dermatologist, Dr. Anne LaFond. She's the dermatology specialist of Canton, but she kind of helped me in, just seeing what she did, and that's when I fell in love with it. But I think, it's kind of I want to say underrated, but it's not as a specialty that people kind of realize is big of a part of medicine as it is. So you kind of had to seek it out and kind of have an interest before then.
Yeah, and I imagine as you start doing different rotations or fellowships or whatever it is during those programs, there are certain things that just are extremely interesting, and you gravitate towards that. And it's like everything else. Everyone's got their own interests, right? So in medicine, I'm sure it's the exact same thing. So that's very cool. So as we kind of hopefully are coming to the close of this this pandemic and kind of getting into this, establishing, better routines and habits. And obviously we're going into summer. Caitlin, you mentioned that May is skin cancer awareness, melanoma awareness. Is that right?
Correct.
Month. So I probably butchered that.
No. Perfect.
Oh, yes. Great. So obviously it's really important for people to, have routine checkups, to have regularity. So what does that look like for people exiting a pandemic and hopefully, getting into a better cycle?
I mean, statistically, it's like 200,000 new melanoma cases will be diagnosed in 2022. And the key is early detection. You detect a melanoma early, and it's 99% chance that you'll be fine. If that melanoma of the skin starts to travel a little bit, your percentages drop down to about 68%. If it spreads to an organ, it's down to like 30% chance of survival. So catching these things early is the main thing. And so like we were talking about, Rob, people getting back into the routine of getting their skin checks. I was telling Rob that I went to my dentist and I get yelled at because it's been 3 years since I had my teeth cleaned. Oh. And you think about the pandemic, it's like, wow, 3 years. I haven't gone to get my regular teeth cleaning. Right. And it's the same way with the skin. People come in and go, hey, I've had this for 2 years and I haven't had a chance to get in. And now, they've grown large in size and cosmetically there's a large defect and things like that. So.
Yeah. And then, yes, obviously with, COVID, everybody was kind of staying home, which we appreciated, but trying to get back in that routine just because, skin is the largest organ in your body. On your body. But, especially with being Skin Cancer Awareness Month, we just wanted to kind of get that message back out of doing your yearly skin checks. And then because like you said, things that we can find early have a much, higher likelihood that we can clear it just in our office. If it's a melanoma and things happen, we have to send you, for further, evaluation. But, skin cancer, a lot of people don't think about it, but, it is probably one of the highest, cancers that patients develop. And with it being Skin Cancer Awareness Month, we want you to kind of be doing like monthly checks just on yourself, just kind of taking a glance. Biggest thing is like things that are new, changing, looking different than some of the other spots that you have. And then, doing your yearly skin checks. We do recommend that you come in once a year because obviously there's things that most patients come in for that they're concerned about, which are just fine. And then we find other things.
Yeah, things are like, oh, that's totally fine. And you're like, it's not.
No, that spot's been there, forever. Well, it really should come off. And then, obviously, with it becoming summer, wearing your sunscreen because that is the number one protection for you.
Yeah, I have no hair, so hats.
Yes, hats.
Yeah, hats all day is the best way to prevent that. So what does it look like for a first-time patient? Like if they want to come and stop into the office, not really stop trying to do walk-ins, but like if they want to.
Actually, we do walk-ins.
Oh, nice.
And same-day appointments.
Yeah, very good. See walk-ins, same-day appointments. So what does that look like for a first-time patient coming in? What can they expect?
Yeah, I mean, if they have a specific lesion they want evaluated, sometimes they come in and we'll just check that one area out. Or other times we'll just come in and patients will say, I really don't have any complaints. We just do a look over from head to toe, kind of teach you a little bit about what we're looking for, kind of go over each individual spot and say, hey, this one doesn't worry us because of this or this, and this one looks a little suspicious, and recommendations for treatments and preventative things like we talked about, the sunscreen, and ways you can protect yourself.
Very good.
Yeah, and then just going to add to it too,
Sure.
that yeah, like you said, we kind of, do skin exams, kind of look you over. And then definitely with, newer age technology, a lot of the stuff is on our iPads that I'm definitely one, I love to take pictures. So it's very helpful for areas, we can kind of monitor moles and things like that, kind of do like mole mapping, because that's a thing too, to see if anything's changing.
Very cool. And I imagine that's something that's always going to keep evolving, especially with your industry, is technology, things like keeping better track of things, probably being able to measure things probably right from an iPad app, and being able to have that record, whereas 20 years ago, it probably looked a lot different as far as keeping track of things like that. Yeah, good deal. So one recurring segment, the only recurring segment on the show, other than people showing up and talking to me about their business every week. So I want to dive a little bit deeper into you guys and learn more about you. So the first question I always ask is, obviously you guys are both medical professionals. That is a process. It's not I'm going to fill out this application and get a certificate in the mail 2 weeks later type of thing.
That'd be nice.
Yeah, right? A lot more efficient, probably more cost effective.
Right.
But if you were to, mentor somebody who is 18 to 22 in that age range looking to go into the medical profession, what is some advice that you wish you would have had back then? Don't do it.
Just kidding.
Yeah. So what are some things? Because I know it's a big goal that's probably the most popular thing that kids want to do out of high school is I want to be a doctor. It's like, do you though?
Yeah.
Well,
that's a lot of work.
I think you're right. I mean, just exposure. Funny story. I was in college and one of my friends, valedictorian in high school, he always knew he wanted to be a doctor growing up. And he calls me up his first year of medical school. And he's like, Jay, I have a problem. I've always wanted to be a doctor. And I realized I really don't like people. And he just he always had the dream, but really didn't know that how much interaction there was. And he's a radiologist now. So he sits in a dark room.
I was going to say, hematology.
Yeah, exactly. But I think, a lot of people have that general, I want to be a physician or I want to work in healthcare, but getting the exposure, trying to, finding the mentor, like fortunately Dr. Perovski and I have found,
right.
And just experiencing, hey, follow a family practice doctor, try to get in with your local dermatologist, see if you can shadow them, try to work at a hospital, see if you like that flow, because they're all very different, and, trying to find your niche.
Yeah, absolutely.
Yeah, I'm just going to say, like, you have to, because yes, growing up, I always said I was going to be a pediatrician, but that's just because I love my pediatrician. But then when I started shadowing people, and I was like, okay, definitely not doing pediatrics. But, just following people, I got to see kind of different things. So I was, fortunate enough where I had early experience in that, and not until, because I think it is hard later in life, at college, you get to college and you don't know what you want to do. I knew going in. So I think trying to get those early opportunities to kind of shadow and see definitely helps. And then just, throughout the process, because med school is tough, residency is tougher, just remembering like the why you started to do this and wanted to do this in the first place.
No, it's tremendous advice because people see it on TV and they're like, oh, I saw it on Grey's Anatomy or ER. And it's like, well, George Clooney's not going to show up to your residency. Like, it's way different when you actually go and do it. So
Yes.
That's great advice. So second question is, what is one thing that you do to unwind, kind of let your hair down, so to speak, when you are not seeing patients?
I do a lot of CrossFit. I go to the gym, just kind of my hour of being by myself, and I have to help anybody but myself for that 1 hour, so I get to unwind that way.
Good deal. So if you need a lift assist, Jason's not your man at the gym. He's not going to help you out.
Let's see. So, I don't have a good answer for this one.
Hobbies.
I know. Well, I used to have a lot of hobbies, but COVID kind of ruined a lot of that. But I love like outdoorsy stuff. Like I did my residency in Georgia and outside of Atlanta, and you don't think about it as much, but there's so many trails and mountains and stuff. So I loved it. I got to go hiking every weekend. Sometimes even after work. That was definitely kind of like my outlet was hiking, and then stand-up paddleboarding was like one that I really got into when I was down there too. So I just gotta go to Jason's house and use his lake.
Yeah, there you go.
There you go.
To get back into it, but we'll say that. I have a Peloton too, but I'm not as committed.
Okay. Yeah, they don't seem to be either as a company.
Yeah, they're not doing as good, are they?
Yeah.
Yes.
So last question is, what is your current favorite piece of technology?
Streaming. I love the fact that you can stream something. I was thinking about that last night. I was just looking at old videos, and I can talk into my Alexa and say, hey, show me a video from someone from, I couldn't even remember the song. And I remember just being able to say it, and then there it is. And, cheesy 80s video of it. But the fact that you can just do that on your phone is crazy.
They're also listening to you.
Yes, that's true.
100%. Yeah, prepare for the most boring listening into session of your life if they're listening to me. What's your favorite streaming platform?
Well, unfortunately, I have a lot of them. I would say Netflix right now. I watch a lot of Netflix. Yeah.
Okay.
Waiting for Stranger Things to come out.
Yes, very soon. And then Action Park is a documentary on HBO that we've been cycling around the office about. That's really messed up water park in New Jersey.
Oh, I remember. I watched that.
Yeah.
Yeah, while the guys are getting all injured and everything.
it's
Yeah,
crazy.
it was crazy.
Watch it. I have HBO. That's the streaming service I do have.
It's an
Yeah.
hour and a half, and it's just the whole time you're just gonna
crazy.
stand there with your mouth open like. So some dude's just like, hey, I want to do a water park. I'm not an engineer. Let's just roll with it.
Yeah, and he has these crazy slides that people are just flying off, and
Right.
what was the one guy with the rocks on the sides? They were
Yeah.
going down the sled and they were flying off, and like he hit his head, and
Yeah,
it's crazy.
How'd they even open?
Yeah.
yeah, it's New Jersey.
I know. I guess that's
Everything's
true.
legal in New
Yeah.
Jersey.
Yes.
What about you?
Oh.
Favorite piece of tech?
I know. I was trying to think of a good answer. I mean, I hate to say it, but obviously, it's just like iPhones are just so easy. It's also the devil because it takes up so much time. But
Yeah,
it's so convenient. Everything's on there and back to work. But they're developing more apps and like attachments so that we can like take pictures of moles and things with our dermatoscope like straight on our phone too. But from a personal level,
Yeah.
it's
yeah. The iPhone is like the brick of the technology world. You can build a hospital with it. You can break a window.
Yeah.
So it's just a matter of how you want to use it, I guess. So.
yes.
No, I completely get that. So excellent. So if people want to get in touch, if they want to know more about how to get a hold of you guys, and also too, one thing I wanted to say is I was doing research for this podcast. You guys have a tremendous amount of reviews. I think it was like almost 250 5-star reviews.
Yes.
So you guys are just super well reviewed. Seems like your patients are super happy and really excited, like engaged with what you're doing actively, which I think is a huge credit to just the leadership and the staff there. So well done on that.
Well, thank you.
Thank you. That's
Appreciate
definitely,
it.
we're trying, I think, it's kind of like I wouldn't say it's our mission statement, but I feel like from the owners of the practice all the way down, their thing is always to focus on patient care and
Yeah.
not always like the numbers and, things like that. It's just to always make sure it's, a visit like you're our family kind of thing. So
And that's tough because in the medical industry, it can also become a cliche. It's like, well, it's about the people. It's like,
Right.
how do you tell them it's about the people without saying it's about the people?
Yeah.
Right.
And
Yeah.
and it's the feedback. It's the
right.
it's people that don't work there talking about it the same way that you do.
And for me, like I've lived in Brighton for 20 years, and so now this past year joining this group, I live in this community. I raise my kids in this community, so seeing patients that are part of it it has a different meaning for me now because some of these people are my kids' classmates or my neighbors, and there's a different kind of pride in that, in seeing those people.
It's tremendous. So website for the folks at home, and we'll make sure we link everything up in the show notes as well. So that way if people are driving, they don't have to worry about texting
Yes.
as they're moving down the road.
Dermatology Specialists of Brighton.
It's just Derm Specialists of Brighton.
Oh, it's Derm Specialists of Brighton. See, I don't even know
Shorten
the
it up.
website.
Yeah.
Yeah.
That's all right. Luckily for everyone, it's in the show notes. So
Yeah.
that way
Okay.
if you're
Well,
like, well,
I
what
only
is it
remember
again?
because he just showed it to us.
Oh.
Derm Specialists of Brighton.com.
All right, very good.
Perfect.
And again, that's all going to be in the show notes. So don't worry about, what did Jason say? What did Caitlin say? It doesn't matter. It's what Johnny the engineer says in the show notes. That's what matters.
Perfect.
All right.
Well, thanks so much, Rob, for having us.
Yeah, appreciate
Appreciate
you
it.
both. That was
All right.
good. It was a good time and
Yes.
good conversation. And
Yep.
I appreciate you guys stopping in today to educate me a little bit more about
Yep.
what's happening in the wide world of dermatology.
Yep.
Yes.
Wear your sunscreen.
Yes.
Yes,
It's
wear your
coming up.
sunscreen. All right, gang. Well, that's going to wrap up this week's edition of the Chamber Podcast. Appreciate y'all listening. Have a fantastic week. We'll catch you on the next one. Take care.